Urologist and Gynecologist break taboos, sex 50+. Welcome, dear viewers of Meaningful Living. Today, we're going to talk about a topic that often remains unspoken but is incredibly important for a fulfilling life: intimacy and sex after 50. For decades, our culture has sometimes implied that sex somehow ceases to exist after a certain age, suggesting it's time to put on a headscarf and forget about this part of life. However, as medical professionals, we're here to tell you that's simply not true. Sex after 50 exists, and it can be filled with new colors, emotions, and deeper connections. Disclaimer for the video. Today's video dives into a really important and often sensitive topic: intimacy after 50. We've done our best to bring you valuable and reliable information from medical professionals. Please remember, the content in this video is for general educational purposes only and is not a substitute for personalized medical advice from your healthcare provider. We strongly encourage you to discuss any health concerns you have directly with qualified medical professionals. Always prioritize your well-being and listen to your body. Thanks for being with us. We often encounter patients who come to us with surprising discoveries. For instance, one patient in her 50s experienced an orgasm for the first time and initially thought it was a hypertensive crisis. It was only through open conversation that she realized it was a new, delightful sensation. This truly highlights how crucial it is to talk about these things openly. Sex after 50. We, medical professionals, see that the topic of intimate life after 50 is incredibly relevant. In our medical circles, where many colleagues and friends have already passed this age milestone, the question of whether sex exists at all simply doesn't come up. On the contrary, we observe how people continue to live fulfilling, intimate lives, perhaps with different, more profound, and emotional nuances. About patients trying to revive their sex lives. In our practice, we constantly meet women, sometimes grandmothers, who at first glance seem far removed from sexual life. Yet, they come to us seeking aesthetic procedures to restore a fulfilling sexual life with their partners, even if both are over 55, 60, or even 70. This proves that the desire and need for intimacy don't disappear with age. We see how people, whom other doctors might have written off, actively seek ways to improve their intimate lives. As specialists, we not only don't dismiss them but encourage our patients, explaining that after 40 or 50, life can just be beginning. The key is to rule out serious urological or hormonal issues, and then to communicate openly with your partner about your desires and any changes, to add new vibrancy to your intimate life. What happens to the body sexually after 50? With age, our bodies undergo certain changes, and this applies to the sexual sphere as well. For men, there's such a thing as male menopause, andropause, which, unlike female menopause, usually occurs later, typically after 63 to 65, and progresses more gradually, without sharp hormonal drops. However, after age 35, testosterone levels in men decline by 2 to 3% annually. This can impact libido, energy, and overall vitality. In women, changes are often more pronounced and abrupt. Physiologically, after age 35, endurance, motivation, drive, and libido can decrease, and there may be a reduction in muscle mass and weight gain. These processes are linked to a decline in the levels of female and male sex hormones, which, although present in smaller quantities than in men, are essential for maintaining collagen in the skin, bone density, motivation, and that overall sparkle in the eyes. Why should men get tested for testosterone? A blood test for testosterone allows us to assess your hormonal balance. For the most accurate results, we recommend refraining from sexual activity and strenuous physical exercise for 2 hours before the test. This is because sexual activity or sport can stimulate a temporary release of testosterone into the bloodstream, which might skew the true picture. However, if a man has an active sex life daily and exercises regularly, 2 to 3 times a week, his testosterone levels will likely be within the normal range, and in such cases, a test might not be necessary. We recommend regular hormone level checks, especially after 35, to monitor changes and respond to them promptly. What causes a decrease in desire in women and men? For women, attractiveness plays a huge role in sexual life. With age, if a woman doesn't feel attractive, it can lead to psychological distancing from her partner, a lack of desire for intimacy, and self-comparison with others. Any careless words from a partner about appearance can deeply hurt. Besides psychological factors, physiology plays an important role. After 35, as we've mentioned, women experience a decrease in the production of male sex hormones, androgens, which are responsible for motivation, energy, libido, and muscle mass. The primary and key recommendation for women is physical exercise, especially exercises targeting large muscle groups, glutes, legs, abs. This promotes the natural production of your own testosterone, which can compensate for hormonal decline and improve overall well-being and libido without the need for replacement therapy in the early stages. For men. In men, desire can decrease due to a drop in testosterone levels. If testosterone is low, we often recommend starting with physical activity. Exercising the pelvic floor muscles, which increases blood flow to that area, prostate gland, testicles, stimulates better production of your own testosterone. What is a normal testosterone level? Normal testosterone levels can vary depending on the laboratory where the analysis is performed. For example, in one lab, the normal range might be from 8 to 27 mol/L, while in another, it could be from 2 to 8 mol/L. This is a crucial point to consider. We always advise patients to get follow-up tests at the same lab to avoid discrepancies in reference values and accurately track the dynamics of their hormone levels. What new rules emerge after 50? Should you start with smoothness? Regarding new rules in sex after 50, the concept of starting with smoothness doesn't exist in medical recommendations for sexual life. The most important thing is desire and mutual communication between partners. Our experienced instructor always used to say, "Sex exists with age." The main thing to remember is, if you get out of breath, take a break. This is about physical well-being, but most importantly, it's about open communication, avoiding unspoken resentments and misunderstandings. Each couple finds their own rhythm. Interestingly, problems with sexual life are often observed in couples between 30 and 40, who are in the sandwich generation, caught between caring for aging parents and raising young children. When children grow up and leave home, the couple gains more time for each other, for communication, and for rekindling intimacy. This is a time when life for oneself and for one's partner can begin with renewed vigor. Fears of men and women after 50. For men, the most common fears for men after 50 are related to the possibility of not performing or falling asleep during sex due to fatigue. It's important to understand that this is absolutely normal. An ideal erection isn't necessary every time. Stress, depression, excessive fatigue, multiple jobs, childcare, all these can impact the quality of an erection. There's no need to dramatize it. For women, women can also have fears, but often these are related to their self-perception of attractiveness and physical discomfort, such as dryness. Many women haven't experienced orgasm even at a younger age and may not even understand what it is. It's important for partners to be attentive to each other's needs. How many times a month can an erection not occur? There is no clear medical protocol regarding how many times a month an erection might not occur. We are against such rigid frameworks. The main thing is that erections occur 2 to 3 times a week, including morning erections. If problems arise regularly and consistently, then it's a reason to consult a specialist. It's important to remember that female libido can be linked to the menstrual cycle, with the peak desire often coinciding with ovulation, when there's a physiological rise in hormones, including testosterone. What's harder to accept? Menopause or erectile dysfunction? Male menopause, andropause, can be corrected with modern medicine. This applies to declining hormone levels, libido, and erection quality. However, erectile dysfunction is often perceived as much harder for men to accept. For women, it might be simpler in this regard. As one patient said, "I haven't been so sick that I couldn't just lie down." For women, the absence of dryness and discomfort is important. Even without orgasm, many women can have a fulfilling sex life. Sometimes women experience orgasm for the first time at a more mature age when their partner becomes more tender and attentive. This can be related to better foreplay and less rushing. How long do women need to achieve orgasm? According to recent research, including studies from the Cambridge School of Sexual Health, women generally need an average of 13 to 14 minutes to achieve orgasm, provided there's quality foreplay. For men, the duration of sexual intercourse usually ranges from 3 to 8 minutes. This highlights the importance of foreplay and attentiveness to a partner's needs. It's important that foreplay doesn't extend so long that the man burns out. The key is to find a happy medium. And a woman's orgasm doesn't always depend solely on intercourse. Sometimes, additional stimulation, such as clitoral stimulation, is necessary. Therefore, foreplay can be a complete substitute for sexual intercourse for a woman to achieve satisfaction. The problem of dryness in women, leading to pain and trauma during intimacy, can be related not only to age but also, for example, to the use of oral contraceptives. During perimenopause, the transition from reproductive age to menopause, estrogen levels decrease, which also causes dryness, impaired skin quality, bone fragility, and a decrease in libido and drive. This can lead to discomfort, depressive states, and a lack of desire for intimacy. Women need to understand that life is fulfilling at every stage, and there are tools to correct these changes. We have the ability to influence the aging process and improve quality of life, even as the body undergoes natural changes. What in modern medicine is truly effective, and what's just marketing? Effective methods. Pelvic floor muscle work. This is crucial for sexual satisfaction and supporting pelvic organs, bladder, uterus, rectum. Kegel exercises. Self-contraction of the pelvic floor muscles. However, women often don't know if they're performing these exercises correctly. Emsella chair. This is a modern chair that generates electromagnetic impulses, causing up to 10,000 pelvic floor muscle contractions in 28 minutes. It's highly effective for strengthening muscles and enhancing sexual pleasure. A typical course involves 8 to 10 procedures, twice a week, repeated every 6 months. The Emsella chair is also recommended for men. CO2 peeling, intimate rejuvenation. This procedure, performed for women, uses CO2 laser beams on the vaginal mucosa. It helps to contract tissues, stimulate natural collagen production, and improve lubrication. It's recommended to undergo 3 procedures once a month for a year. This is a very effective method for addressing dryness and increasing sensitivity. Marketing. Beaver stream, Brobova strua. This is an example of outdated and ineffective folk remedies that lack scientific backing. It's not worth trusting such miracle cures. What works in hormone therapy? Hormone replacement therapy, HRT, is an effective method that often scares men over 50. This fear stems from myths about the need for constant hormone intake. In Europe, for example, in Italy and Spain, men over 50 look so good because they have mandatory annual outpatient visits and medical checkups guaranteed by the state. They monitor their hormone levels from ages 35 to 40, and if hormone levels drop, they might undergo a course of treatment every 3 years. In the US, men often seek help only after 50, when hormone levels are significantly lower. HRT doesn't mean constant hormone intake. It's a course of treatment, after which it's important to monitor hormone levels at least once a year. If symptoms like decreased libido or erectile dysfunction reappear, hormone levels can be adjusted again. The goal is to maintain quality of life, not just cure a problem. Society is still wary of HRT, but understanding will eventually grow. Women. About fillers and hyaluronic acid. Besides the loss of skin turgor in the face and neck, age-related changes also occur in the labia. With age, they become less plump and flatter. This can lead to the vaginal opening not fully closing, which increases the risk of infections, colpitis, dryness, and trauma. Therefore, in aesthetic gynecology, we use labial fillers, hyaluronic acid, to restore volume and address issues with the opening not closing. This is not only an aesthetic procedure but also medically indicated. PRP, platelet-rich plasma, injections for dryness to hydrate and regenerate tissues. Botox injections in the sexual sphere are used less for cosmetic reasons and more to address medical problems like vaginismus. This is a spasm of the muscles at the entrance to the vagina that makes intercourse impossible. Botox helps to relax these muscles. If there's no money, what can be recommended? If expensive procedures aren't an option, there are accessible and effective alternatives. Lubricants, moisturizing agents that significantly enhance comfort during intimacy, especially with dryness issues. They can be purchased not only in sex shops but also in pharmacies. There are medical-grade options. Dilators, stretching trainers. These are devices that help gradually stretch the vagina, especially in cases where spasm or dryness make intercourse painful. They can also be purchased in specialized stores. It's worth noting that Botox and hyaluronic acid are also used for men, for example, Botox in scrotalplasty. How to experience a second youth if your partner is younger than you. A partner's age is not a barrier to a fulfilling and happy intimate life. The most important thing is your inner feeling and harmony. If you are in a relationship with a younger partner, focus on your shared interests, mutual respect, and deep emotional connection. Your wisdom, experience, and ability to enjoy life are your strengths. Sexual attractiveness isn't just about appearance. It's about energy, confidence, and the ability to openly express your desires. Have you encountered cases where someone had their first time after 50, having moved out of their mom's house long ago? Yes, in medical practice, various stories arise. There are cases where people over 50, having lived alone or in unhappy relationships for years, finally find a partner and discover a fulfilling, intimate life for the first time. This can be due to finally breaking free from societal norms, stereotypes, or dependence on parents. When a person is ready for change and open to new relationships, age is not a barrier. What should a romantic date look like for a couple after 50 to be captivating? A romantic date for a couple after 50 doesn't have to be different from dates at any other age, as long as it's filled with shared interests and a genuine desire to spend time together. Shared interests. Choose activities that both of you enjoy. This could be a walk in the park, a visit to an art exhibition, a concert, a joint workshop, or simply a quiet dinner in a cozy place. Communication. The main thing is the opportunity to talk, share thoughts, laughter, and memories. This is that precious time when the children are grown, and you can dedicate it to each other. No rush, enjoy every moment. Romance isn't always about passionate emotions, it can be about depth, tenderness, and mutual understanding. Call to action. Remember, dear friends, sex after 50 is not an end, but a new beginning. It can be more conscious, emotionally rich, and pleasurable. The most important thing is openness to change, honest communication with your partner, and a willingness to take care of yourself. If you have questions, doubts, or discomfort, don't hesitate to reach out to medical professionals. We are ready to help you dispel myths, support your intimate health, and make your life fulfilling at every stage. Because here at Meaningful Living, we believe that every day should be filled with meaning, joy, and harmony, regardless of age. Take care of yourselves, love, and be happy.